How are you doing today? I'm Dr. Babala. Welcome to my channel, Health Discourse Ask the Doctor. Like you all know, this channel is primarily for health discourse that deals with 4 states that you can easily and always apply even before you have access to healthcare facility wherever you are across the country. And it's actually primarily meant for those common medical emergencies. So today I'll be welcoming everyone that is joining us for the first time on this channel. This is Health Discourse Ask the Doctor. Please click the subscribe button, share the video, and I appreciate the like button as well. Feel free to comment, share your experience with others in the comment box, chat with others in the comment box as well, as we shall be having a discourse today. For today's discourse, the topic is asthma. I'm sure asthma is one dreaded topic that most people, or one dreaded health condition that most people do not want to even discuss because of the myths that have been shared on this and a lot of false information that have been shared across the society, and people feel rather than discussing, let me just keep moving. Just like when we are discussing hypertension, a lot of people feel, oh, this is something I shouldn't even discuss because I'm so much afraid. Or when we are discussing cancer, people don't want to discuss issues related to this because the fear is so much that they don't even want to hear it. But like we always say, that knowledge is power. Knowledge helps you to know what to do and what not to do, and helps you, knowledge is quite preventive. It helps you to take the right step at the right time. So in view of this, today we'll be discussing asthma. We can't shy away from this because for each family, it is hard for you to go through each family, most especially in Nigeria and even certain countries, without having someone that is having airway hypersensitivity. So what is asthma? Asthma is a form of hyperactive airway disease in which the airway gets triggered to certain things that most people do not get triggered for. What I mean in essence is that the airway become reactive to certain common things that people naturally don't react to, and when it reacts, it now makes the airway to be narrowed. So let's take, for example, as an example of one of the triggers, dust, smoke. Naturally, for most people, they can get exposed to dust even without having any issue because they have that high threshold to dust, such that if their threshold is at 10 level, maybe the best they can get from dust that they have been exposed to is just at 5 or 6. So those people, their airway wouldn't even react in any way. But this set of people that are asthmatic, their threshold has been brought low, such that even when they get exposed to a little state of dust, their airway now begin to constrict, or the mucous lining of the airway swells up. So when these two happen, what it causes is that it makes the airway to be narrow. So what asthma means, in a simple term, means hyperactive airway condition, so that the airway becomes narrow and thereby leading to respiratory distress in such individuals. So what are those myths about asthma? One, asthma has been termed to be a strange disease that happens to people in a strange way. One, or it means death, or it means an uncommon disease that mustn't happen to people, so that when people have it, they feel scared and they're actually afraid of this stigmatization from people. So because of this stigma, people shy away from discussing it or even disclosing that they're asthmatic. So these are the myths that have been going on. The other thing is also that, oh, it's a disease that is not curable. So in view of this, people shouldn't even discuss it because of the stigma that, as much is not curable, they should rather stay away from discussing it because people will actually associate them with a disease condition that's going to kill them. No, that's not the way it's supposed to be. As a matter of fact, this is the disclaimer. that anyone with asthma can as well live a normal life like every other individual. Mind you, I stated earlier on that asthma is not a death sentence. It is just an hyperactive airway disease condition such that people have different threshold to certain substances. So in view of that, people with asthma, the only difference is just that their own threshold is low, while other people that are not asthmatic, their own threshold is high. Mind you, and that's the reason why some people might say, oh, at a particular age in time while I was young, I was not asthmatic, I play with dust, I get exposed to fumes, other substances, and I didn't have any airway hyperactivity. Why must it be now? The simple answer is that as at now, the threshold in you or the individual has been reduced. So that simply explains the fact that if you might not be asthmatic today, over time it can develop. Though it has a genetic predisposition, but even at that, we also notice that people that have these allergic airway conditions, like those ones that have this all year round runny nose, that all through the year in their family, they always have this catarrh. There is no any time of saying, oh, dry season or rainy season. They always have this. It has been noticed that over time in this group of individuals, there is a possibility of finding one out of such family or more that will later come down with asthma. So that's to tell you that it's an allergic condition, and then that doesn't mean that it's a death sentence. So what are those symptoms, those signs you are going to see in an individual that will make you to feel, oh, is this individual having asthma, or an individual that has asthma that will allow you to take preventive measure or to assess, to go for care? Number one, for individuals with asthma, you notice them coming down with this soft cough just suddenly. Some will just be in the form of clearing their throat. You see them clearing their throat over and over again. What that means is that at that stage, they have started feeling a bit of discomfort of the airway, so that the airway seems to be narrowing, and they are trying to see, let me start to expand it to allow more air to come in. Over time, it progressed to an active cough, so that they begin to cough, and the cough is not productive. They are not producing anything at the initial stage, just a dry cough. What the body is trying to do at that stage is to allow the airway to be open, because I'm going to discuss the pathophysiology in a layman. What it means is that I'm going to discuss the process of asthma coming to place, how it happens, how the symptoms come to play, the reason for those signs and symptoms you see, the mechanism of it. I'm going to discuss it shortly too. So what it means is that they try to open the airway to allow more air to come in. So the cough starts. From cough, you begin to see that they are now using their nose to breathe, nasal flaring. So that's to tell you that the individual is now having respiratory distress. Later it progresses again to difficulty in breathing. You see them moving their chest, they're having this difficulty in breathing. So at this stage, it has fully blown up, and the individual will need an urgent attention. If at the point of the cough, before it gets to nasal flaring or difficulty in breathing or restlessness, the individual have access to care or the inhaler, which I'm going to talk about as one of those things that can be used to tame the progression of these symptoms. The individual will get relief and they get better. So these are the symptoms you will notice. This sudden cough, dry cough, starts gradually in form of clearing of throat. Frequently, it moves to an active cough. Then it moves to nasal flaring, difficulty in breathing, moves to breathing heavily. It moves to distress. The individual is not well organized again because the person is distressed because of lack of adequate oxygen, because the airway is narrowed and there's not enough air that goes into the bloodstream to oxygenate it, thereby making the cells of the body and the organs of the body to have deficiency of oxygen. When this is in place, all the whole body begin to malfunction. The individual is become restless. So these are the symptoms you will notice. I've talked about the mites, I've talked about the symptoms. What about the triggers? What are the causes of asthma? we talk about triggers. Most of the time we use the word triggers because they are actually being caused by certain things that trigger the episode that I've just mentioned about the progression of these conditions. The triggers could include exposure to dust, and that's why I mentioned the other time that the threshold to all these triggers have been brought low. Exposure to cold, either drinking something that is too cold or cold weather. Exposure to fumes from the car or from the kitchen. Exposure to perfume that is too sharp. Some cannot tolerate sharp perfumes. Exposure to a respiratory tract infection. It could be malaria or any form of sepsis. They can trigger that because any form of sepsis that can have its focus in the chest definitely will affect the respiration and the breathing, and definitely will trigger the episode I mentioned. So some actually have trigger in the form of pollens or flour. Some even cannot even stay in a room where rug is being used because rug absorbed dust. So when they stay there, by the virtue of movement, there is that trigger of dust that is circulating, that is not allowing the air to be free of those dust. They actually get triggered as a result of that. Some even sleeping on a mattress that is not covered with a cloth as a layer, because by the time they sleep, their nose is in direct contact with the foam. So due to that, they inhale those dust or certain particles that might have been absorbed in the foam. So thereby triggering the episode we mentioned. Some just have maybe the danders, or even some cannot even stay with rats. So because the hair from rats also trigger such reactions in them. So individuals actually have specific triggers in them. So all we need to do when we're taking care of them is to elicit and ask those questions in those areas. Do you react to this? When you stay close to this, is it when you stay close to this particular thing that this happen? Is it when you do this that this happen? Even to some, exercise induced, stress induced this episode in certain people. So you need to know what is specific to certain individual, which will help you to be able to know how to address and how to prevent the subsequent episode that may occur in them. So we've talked about the causes, we've talked about the science, about the mind, what asthma is all about. Let's talk about how will you manage an individual coming down with asthma. You as an individual or a relative or a loved ones coming down with asthma, how will you manage them? Number one, when an individual is in acute state, already having difficulty in breathing, what you need to do is to allow them to stay in a well-ventilated area. Open the windows, let them get good exposure to air, fresh air. Do not put on the AC, do not put on the fan. Note, extremes of weather can actually trigger the episode or make it worse in them. What do I mean by extremes of weather? Too much of cold weather, too much of heat can trigger the episode. That's why they are individuals that need to master themselves, and then other people around them need to master them and help them out in managing each episode as it comes. Mind you, the fact that the episodes are coming doesn't mean that they have signed any death sentence, not at all. But just for you to know what they like and what they don't like. Just like an individual that will tell you, oh, I don't eat cassava, I don't eat mango, I don't eat carrot because I react to it, I don't take beans because I react to it. It's the same thing with this individual. So there's nothing different. It's just for you to know what you react to and stay away from those triggers. So I'm saying this so that you'll be at peace and be reassured that you are as good as every other individual. All you need to do is to master the triggers and know how to prevent and stay away from those triggers. So having stated this, so you need to allow them a good ventilation. You allow them to sit up. Do not lay them down, not at all. Allow them to sit up where they can sit up properly like this, and then the next thing you need to do is to allow them to extend their neck. When you do so, it allows free air to enter because the airway is open by extension. If you sit this way, the airway is not properly opened. So when you extend the neck, you allow them to open the neck, and then air can go into the airway. The other thing you need to do in an acute state is to confirm if they have an inhaler, because at that stage the inhaler is a good first aid. Mind you, we have two types of inhalers. We have a short-acting inhaler, we have a long-acting inhaler. For this form of emergency, all you need is a short-acting inhaler, which is used for emergency because it immediately acts on the airway and takes away the symptoms and it relieves them. If you do not have this, the other thing you can get is to quickly get a prednisolone tablet. A prednisolone tablet nearby in a chemist shop also, because when you give this prednisolone tablet, what it does is that it helps to reduce the swelling. I'm going to talk about that pathophysiology now. It helps to reduce the swelling while you are on your way to access medical care. You don't take it and just sit down. I'm just talking about the first aid now. Mind you, everything we are discussing on this channel is to give you first aid, those things you can do before you get to be evaluated by your doctor in the hospital, so that you'll be able to save time, you'll be able to save the individual and ensure the individual gets to the hospital safe and sound, while the doctors or the health caregiver will be able to continue where you have gotten to. This will help to avoid the poor prognosis and change it to a better one, so that the individual will come out with good results and be fine, rather than not doing anything. So when you're on your way to the hospital, these are the things you need to do while you get set to go into the hospital. So these are the things you need to do. You give them water, allow them to take a lot of water, because of the respiratory distress they are into, they're exerting a lot of energy and pressure on their chest, so you could see them sweating too. You need to give them water. This will go a long way, so it will be a lifesaver. Mind you, let's talk about the pathophysiology. What is the pathophysiology? What is the mechanism of action? How does this come to play? This is how it comes to play. When they get exposed to the trigger, the dust, the fumes, and the like, what happens is that these triggers initiate two major things on the airway. One, it constrict the muscles of the airway, thereby making them to be narrow. Two, it actually leads to swelling of the mucous membrane of the airway, which is the inner lining of the airway. These two in conjunction will lead to the constriction, narrowing of the airway. When the airway is narrowed, what it does is that it actually reduces the volume of air that gets to the blood. So when the volume of air that gets to the blood is reduced, oxygen that gets to the blood is reduced. When the oxygen that gets to the blood is reduced, the oxygen that gets to the cell, the tissue, and the organs, they are also reduced. When all these things come to play, the brain senses that there is hypoxia. What it means is that there's reduction in oxygen circulation. And when cells are not getting oxygen to make energy, to be able to work and perform their functions, the cells begin to be in distress, the organs begin to be in distress. And what the body will do at that time is to begin to increase the breathing rate. And that's why you see them breathing heavily. What the body is doing at that time is to complement the oxygen that is not enough. What it's doing is that if the body cannot get the volume of oxygen required per time, what the body is doing is that, let me increase the rate of my breathing so that I can take in those little ones at a higher number of time. So let's say, for example, for you to be satisfied with your food, you need to take 20 tubers of yam, for example, or 20 morsel of pounded yam. But all you have per time is just one morsel. So for you to get that 20, why not just take the one you have now and increase the number of places you get one? So if you get one morsel of yam from 20 people, you have been able to fulfill that quantity that you want to be satisfied, right? So that's what the body does. Body will now increase the rate so that for you to get the volume it gets when you are relaxed breathing, that people cannot even tell that someone is breathing beside them. What the body is doing now is that, okay, I don't have that luxury of breathing with ease gently. Let me increase the rate of breathing. When it does that, the breathing rate increases, and the volume that is taken in, those little volume, gets to sum up to be something worthwhile for the body. And that's the way body helps us to be able to sustain the individual. So during this period, the individual increases the respiratory rate, not by itself. It's a spontaneous measure the body takes for us to survive. It's a survival mechanism. So these are the things the body does, and that's how it was, because the airway is narrowed. So when the airway is narrowed, what the inhaler that the individual takes does is that, and that's why we talk about you extending the neck to be able to help you to open the airway as an additional measure. You getting the inhaler, because the inhaler will help to relax the muscle back, thereby opening it up, because it has constricted and narrowed, but now it wants to open it up, and that's what it does. The other thing, when you take the prednisolone, or when you get to the hospital and they give you the necessary injection, which I'm not going to mention here, because there are some things we don't want you to practice at home. We just want you to get the first aid that will lead you to, that will be able to sustain the victim in getting to the hospital. It helps to narrow the airway, while the corticosteroids, which is the example prednisolone, it helps to reduce the